So when we're scanning and looking for a point, we pay attention to the tone changes. And you can hear the tone change as I'll go up to find a point at maybe shin min level, which usually comes in at about 1 megohm. 1 megohm. There we are right there. Push the button and treat it. And we can tell the frequency is off. That's what it should sound like at 10 hertz, as you hear there now. And it beeps every 8 seconds. 7 to 10 seconds is influencing a point. Beyond 16 is sedation, but you don't stop at 16. For 2 or 3 years we did. We treated a lot more points. We treated 3 to 4 to 5 to 10 times as many points, but we found out in a Vienna meeting with Dr. Noget that the fewer points you treat, the better. Adequately treated the points in the back of the ear having to do with the motor neurons. We went to the back of the ear for motor neurons, for joint problems, and your backs, your shoulders, your necks, even including some of your headaches. The back of the points even work better than some of the sensory points. The anterior portion of the ear is sensory. The back of the ear is motor. Look at the maps well, and look at the readings you get, and you may check phase 1 and not find a point, but going down to the endodermal layer, which is in phase 2 in the concha, and now you can go back and recheck in the lumbar if it's a back problem, and you'll find a point that didn't exist to begin with, but you're removing blockages. And blockages, we'll talk about toxicity, we'll talk about toxic scars, and we'll talk about amalgam blockages, and we'll talk about laterality and oscillation in another video and another DVD. But if you have a blockage, well, sometimes we have to worry about removing that blockage in order to get the ultimate in success. But the power auriculotherapy has, many times we're going around those blockages because of looking at the endodermal and ectodermal layer. The ectodermal is a superficial layer. The mesodermal is the middle layer. That's where we find the musculoskeletal body in the first phase. And the endodermal is the deep layer. That's where we find the musculoskeletal body in the second phase. Like that's in the concha, and that's what I use a lot. Some feel they get better results initially on most of them at this third phase, ectodermal layer, but I found overall that the endodermal is by far is where sometimes I start first. Now if you're looking at taking an exam, nothing about the phases is in that. And if you look at Dr. Beata Stittmacher's work, she doesn't have the phases, but they do have, which will come in a different, we do have the meridians in the ear, and we have them localized, and it's on our chart that we see, like you see with this chart here. We have the meridians, all of the meridians are also can be treated through the ear. Here's a chart, here's one that I put together about what's off a little. This red one needs to come down a little because this is where you find the cervical, the red one here. This is the thoracic, this is lumbar, and this is sacrum. That area alone, if you measure properly and get down to 2 or 1 megohm on your points, will generally get you 7 out of 10 out of pain in less than a couple of minutes. And rarely you have to go over to the ectodermal layer. This is cervical, thoracic, lumbar, and sacrum, and the ectodermal layer. This is cervical here. This is, which is where we left off. There should be one down here that shows the cervical. This is thoracic. Between here and here, this is where C7T1 connect, is right about this level. This is thoracic, this is lumbar, and this is sacrum. Using the back of the ear for the motor neurons. This alone will help you on 7 out of 10 of your pain patients, just looking at this one chart here. Adding the shin min point, autonomic point, the 0 point, which is right about there, the thalamus, which is behind, right, if you put a needle right there all the way through to where the concha floor meets the subantetragus, and the endocrine for hormonal control here. So the 1, 2, 3, 4, and 5 points for circulatory is autonomic point. That's right at the end of the sacrum spine. That's where you find the autonomic point for circulatory problems.